Heart to Heart with Saima. You're listening to Saima Dillon with Heart to Heart with Saima, the podcast show for people searching for that courageous person within us who wants to be inspired by listening to stories of ordinary people doing extraordinary things. I'm Saima Dillon, your host. Thank you so much for taking the time out of your day to be here. Let's dive right in. My guest today is Erum Khaleeq. She's a psychiatrist by profession. Psychiatry is all about heart, mind, and soul. Being in the profession has helped her to be more human and feel the sufferings an individual can go through. She herself got into a car accident in Houston on the third day of her residency training back in 1997 and has been in a wheelchair since then. She has seen many patients, both with mental and physical limitations. Soon she came to realize that mental disability is more challenging than any physical disability. In our daily lives, we face the dilemma of mental illness where people don't come forward and seek help. Things need to change globally, where we develop better understanding of mental illness and make use of all the available resources to utilize and seek help before it is too late. And without further ado, let me bring Erum on. Hey, Erum,
Hi,
welcome
Saima.
to Heart with Saima. It's my honor and pleasure and privilege to have you here on my show. How are you?
Good, good. Thank you so much for inviting me and having me on your show. And thanks for a wonderful introduction. I
You're
really
most
appreciate
welcome.
how you outlined people who are struggling with some mental challenges, and you're bringing this important topic to public awareness, which is really a good thing and a positive contribution to our community.
Absolutely. Because mental illness is something which is not visible to the naked eye. Um, it is considered, it used to be considered such a stigma and taboo because nobody would understand that, that this is serious, mind, body, soul. Everything has to be in sync and everything has to be aligned, whether it's our physical well-being, it's our mental well-being, it's our emotional well-being. They all go hand in hand, and
Yeah.
that's how the creator has made us. Because if anything falls out of alignment, then basically our whole well-being is out of place at that point.
Yeah. I mean, if you see how we define mental health, it's important to know what's actually mental health means. It means it's actually a state of mind where we feel socially, psychologically, and emotionally stable, and we are fulfilling expectation of our surroundings, our society, and people from us. And we all try our best, according to our means and the resources and the support around us. We try our best to accomplish in our life whatever we are doing. But sometimes it's not easy to maintain the balance, and we just, it's not that we are weak. Sometimes things get out of control, and not all of us know how to handle that. And that's where we need, an expertise or a person who would actually help us and pull us out of that situation.
Guide us, diagnose it,
Yes.
most
And
important.
first of all, diagnosis is important. First of all, you need to understand that you are suffering.
Yeah.
Sometimes we have no awareness of what happened and how things are going wrong. We have no idea. Even though we are suffering, we are feeling bad, we are crying, we are not sleeping, we stop eating, but we just simply can't pinpoint, oh, there might be depression, or I need somebody to talk to and get some help. And sometimes people think, oh, I have this best friend I can talk with, or my family member, but that's not always helpful. I mean, they're not professional people. They can empathize with you, but they won't teach you, I mean, some coping skills, how to deal with certain stressors. So that's when, where the mental health expertise, the therapist, the psychologist, and psychiatrist, they come in the picture.
Are there like certain trigger factors, certain things that as individuals we should look out for? We should look out for in our children. We should be aware of. What are there any trigger points?
Yeah, I mean, mental illness has three components. I mean, we have to look at the background. When I get a patient in my clinic or whenever I see a patient, like nowadays, all is all through virtual. It's a visual or audio interviews. So I always look at them from three aspects. First of all, there's a genetic predisposition. Like somebody has a genetic loading. If they have a family members with depression, anxiety, bipolar illness, even schizophrenia. So if there's a gene they're carrying, and that doesn't mean that they're going to be automatically have depression or bipolar. There has to be an external stressor, which would trigger an episode because they are already vulnerable. They're already prone, to break out or break up and
Yeah.
things they never expected. And then there are some other things, some psychological, some social trauma. Psychological meaning like, it has to do a lot with the way you were brought up. Things happen to you in your childhood, any kind of trauma, you lost your parents, you were abused.
Yeah.
It could be verbal abuse, physical or sexual abuse. And then socially, you like death of a spouse or a child, or problems in a relationship, problems with finances in your job. So all these things, together, they could trigger an episode which you call either depression or anxiety, which are the most commonly occurring disorders. And then that's where we don't know. We just start swimming in darkness, and we have no idea how to get to the bank and how to find, a solution of the difficulties which we are facing, or the challenges we are coming across.
So, like, even if you see, first of all, that generation, like my mother's generation, for example, in that generation, I mean, the concept of mental illness was hardly there. I mean, there were times when even if we would see that, because we are human beings, I think it's very important for us to come to terms with the fact that as human beings, we are all faced with multiple challenges in our life.
Yeah,
We are hit by challenges, trials, tribulations, things that we are constantly coping with different circumstances in our life. So things happen where, in our parents' generation, this was not even, like, this was not really there, right? So it's so difficult to think that, oh, you know what, my mom suffered from it, so there's a tendency that I have those genes in me and I should be more vigilant. I mean, it's all these thoughts are so
yeah.
difficult to have.
That's a very interesting point you bring up, Saima. The thing is, even in this generation, it's not just our
Yeah.
parent generation. We still have some people where it's a taboo. It's a stigma. Oh, people think that we are weak or we don't have the strength to handle the stress. And some of us, like especially in our Asian and South Asian culture, we have this thing. Oh, this is all in your head. You need to come out of it, and you'll be okay. You'll be fine. I mean, that doesn't help. I mean,
Making excuses. You
yeah,
hear
yeah.
terminology, right?
And
Yeah.
sometimes we think, okay, it's okay.
Yeah.
It's okay if you're feeling bad. It's okay to feel bad. No, it's not okay to feel bad. You have the right to stay happy. You have the right to enjoy your life and be productive to yourself and to your family and to your surroundings. You just can't give up and just thinking that you will be pointed, oh, somebody suffering from depression or taking medications.
Yeah.
So it's just a lack of awareness and education. So we have to educate our public and people that
That it's okay.
there's help. Yeah, it's okay. It's just like you have diabetes or you have hypertension.
Yeah.
You take meds for the rest of your life, right? And
Yeah.
if you don't, and same, it is a biological illness where you have a chemical imbalance. There are some neurotransmitters which we get deficiencies of, which is serotonin, norepinephrine, dopamine. They all control our mood, our behavior, our thinking. So if there's a disbalance, we have to have medications to bring back that balance. So we would know it's not going to fix your problem you're facing, but it's gonna help you cope with it in a positive way, so you don't feel as distraught or as heartbroken. Oh, this thing happened to me. Yeah,
What
things
are
happen
some
for
of the
people.
indicators? I apologize. You were saying something and I interrupted you.
Okay.
Although
Okay.
I was just asking you, what are some of the symptoms? If you find yourself doing what, then it should be a trigger factor.
Okay. Uh, I see two most commonly occurring problems in mental health. Anxiety is the most common, and depression. So there are things which you could notice. And if you're not noticing, maybe your family member or whoever you're staying with, your partner, maybe they can notice that there's some changes in somebody's thinking or mood or their behavior is noticeable. Let's say, for example, a teenager. They might start feeling, in school, they don't get good grades, they're being more irritable, they lash out easily, they get angry, they're upset at their parents, with themselves, and they have loss of interest. They will stop doing things like going for exercise, seeing their friends, things like that, and their appetite is not there, so they don't eat, or sometimes they eat more. Their sleep is disturbed. So there are many things which we can start noticing that there's a change, and this is not this person normal behavior or pattern of life. So that's when we should be careful about these things and point out to that person, or probably suggest that you need some help, or even for your own self. You can start noticing that things are not going right. I'm not thinking. I'm always thinking negative. It could be things could be better if
I'm
somebody.
always posting negative stuff on Facebook.
So it's just I think it's like you just have to be educated about it and just be aware of.
Seek help.
Yeah, yeah, and that's
Right?
the
I
main thing.
think that's so imperative that if you are and that goes for any aspect of our life, right? If something feels amiss, you know what? Go seek help.
Yeah, yeah. But the thing is, if you feel that it's missing, if
Yeah.
you realize that something is not right, sometimes we have no insight of why we are or why somebody is behaving the way they are behaving. They say, okay, well, you need to just get this thing fixed. And we are not paying attention to why is he behaving the way. We don't accept it. Well,
Yeah.
something is wrong, something is not right. And then there are some other exposures, like if somebody is being medically ill, like if they have a stroke or heart attack. 80% of the patients with heart attack and stroke, they go into depression. That is for sure. But we have a tendency to say, no, 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 they'll be okay, or they have their family around them. What's the problem? What's wrong? There's nothing wrong with them. They should be okay. We just give them some time. But that sometimes they can't come out of it on their own. We all use our inner strength, our instincts, our support system, but sometimes that's not enough because there's a chemical imbalance. It could be due to an infection, could be any other medical illness like multiple sclerosis, stroke, Parkinson's. I mean, all sort of medical things. Cancer is a big one. People with cancer, they have depression. So these are the things, we need to pay attention. We're trying to get help for their cancer. We're taking more chemotherapy, but we don't pay attention that they're also depressed. And same, see, my specialty is geriatric psychiatry. So I want to pinpoint something for our elderly population, especially in Asian and South Asian culture. We have a tendency to, I mean, if our parents are staying with us, or grandparents, and if they stop eating, if they're not communicating, if they don't find joy in meeting with their children or grandchildren, there's something is wrong. And I've heard, the kids started telling their parents, well, what's wrong with you? You have nothing to be sad about or bad. So you need to come out of this. Why you're not watching TV, and why you're not doing this and that. I mean, we just start blaming them for their behavior instead of trying to understand or empathize or seek help. So I think it's just about, educating people. You don't know what they're thinking. I mean, it's a loss of autonomy, the loss of independence, being dependent on their children, they're losing their peers, their siblings. You don't know what's going on in their head and what's bothering them, right? It's not just a simple life event. There
Yeah.
could be things, they're feeling bad about.
So, Iram, we started moving so fast. I would like to kind of come back and would love for you to give an introduction about yourself. I think right there, you're not just here as a psychiatrist. You're definitely here as a very empowering woman. Um, Third day
Thank
of
you.
your residency, and you got into a car accident, and you became wheelchair bound at that time. I
Yeah.
can't even imagine what you must have gone through at that time. And then to show the resilience that you showed, and you're right here, you are um, empowering other people. You are part of this organization where you're part of this helpline where people can call into just to speak to someone if if you're going through anxiety, depression, or you're suicidal or any other mental indeficiency or emotions you might be feeling. Would love to just give you the stage and tell us about your journey of life.
Okay. Well, thank you so much, first of all, for saying all these wonderful things about me. I think I try. I'm not sure if I want to be where I want to be, but we all are trying. So telling about my life journey, this 1 hour show may not be enough. I mean, I can write a book on how it's not just started when I had the car accident. Even way before that, we have really faced some challenges in our lifetime, which I think we I have come across things, but there's always support, and I guess it all depends about your brought up, about your parents, your siblings, and how you respond to different situation. So just let me just give you a little bit background of who I am, what kind of person I have become with all these things in my life. I'm from Pakistan. I was raised in Pakistan up until I was 6 years old, and my parents, they were both physicians, by the way. My dad was a pediatrician, and mom was a family practitioner. So they both moved to Saudi Arabia with three of us, three children, and I'm being the oldest. So we stayed in Saudi up until I went to a medical school, and then I got married. We were in Saudi Arabia and we lived in different cities. So I was exposed to that culture, and I was looking at, Arabs and their women and how they treat them, and how they were actually spoiled, some of them, by their husbands. And so there were like different aspects. And I was just a little girl growing up. Sometimes there was no HIPAA policy or patient confidentiality back then. So I went to the clinic with my parents many times, and I see that they come and they're crying, they're in pain, and they're telling their stories to my parents. But by the time they left the office, they were all smiling and happy and relaxed, as if they have accomplished something. I mean, they were given some kind of hope. So, and I was thinking, oh my God, just listening and talking could have such a power in influencing people's life. So going to medical school was not my thing. And then at age 14, my mom died of breast cancer. She was diagnosed at age when I was 12 years old, and she was treated in Guy's Hospital in England. So we were going back and forth for her treatment, and then she died in England, and she got buried over there because that's what she wanted. She didn't want to go anywhere. I mean, to take her dead body. So I think that was the hardest journey that time when we buried her. And our third day, we traveled back to Saudi Arabia. I mean, three of us and our dad, and we were just all quiet. And we were like in shock. That was the longest, I think, 8 or 10 hours journey I ever had in my life, which, okay, we're going to go to a home and there is no mom. So, I mean, and after that, there in Saudi Arabia, there is no family support. We don't have any aunts and uncles, grandparents to support you. It's just us and our dad, and he was working full time, day and night. So anyway, and after 2 years, my dad got remarried, and our second mom, she was not a physician, but she was a writer. She has written many books and novels on Islamic history and history in general. So she was a story writer, and she was not like a typical stepmom, the concept we have that she's mean. She's not mean at all. She was a very loving person, very family person, and actually she actually turned all three of us in a very positive way, where we always, bring out positive out of negativity, and we always think about others more than ourselves. So I mean, going to medical school was not my thing, but then I realized that's the only way I could offer some help, and choosing a field of psychiatry would be, it's something. And this is what, I don't know, one of your questions said that what gives you a high. This is what happens when I treat patients, and after a few weeks when they come to my clinic, when they walk in, they're totally different. I mean, they're walking, their affect, their demeanor changes totally. They're laughing, they're smiling, they're
Just
so
like your
happy.
parents did when
Yeah,
patients walked in and left
yeah,
your father's clinic.
yeah. I mean, I know, I'm so happy for them. I mean, I just can't believe it's the same person I just saw a few weeks ago. And he was totally like, he was not making eye contact. He was crying, or she was crying. And then, so, that's what happens. So anyway, going back to my story. So my parents, um, they became an immigrant back in the 90s, and they were very people person. They're very social. They actually, there's a radio show called Young Tarang in Houston. My dad used to do a segment in that and giving advices to people, and he was also a religious scholar. He memorized the Holy Quran, and my mom was very supportive. And so I always see people at my dinner table, lunch, breakfast, anytime anybody can come, and they can just get any advice. They're suffering. Sometimes I still remember my mom told me one morning that today somebody called at 5 o'clock in the morning, and we were deep asleep after offering their Fajr prayer. And so my dad picks up the phone, and he says, the other person asked him, "So what are you doing, doctor?" He said, "I was waiting for your phone call." And my mom said, "Why you did not say that you were sleeping?" And my dad said, "I don't know what they're calling for. They may be in distress. Why should I give them the idea that, they made a mistake by calling me, right? I should support them and try to make them feel welcome." So I think those kind of things, looking at my surroundings, give me some idea that, I think I could do that. I to bring a smile to somebody's face is a big, big achievement. So, I mean, that's how, and then when the car accident happened, oh my God, that was see, when we are born with disability, this is something different, right? Because we grow up with a disability, but you're walking, all of a sudden, you don't have any feelings below your chest, and you're wheelchair bound with all the other things, and you just don't realize that your world turned upside down. So it's not that I was in severe depression. I was losing 2 to 4 pounds every week because I was not eating. And, my parents didn't know what to do when they were trying to be supportive. My husband was very supportive. And my kids were like, KG and I think first grader. I have two daughters. So they were very young to understand. And they said, "Why mommy is not walking?" I mean, they were questioning me sometimes that, "Why don't you get out of your bed or wheelchair and start walking?" But my husband remained supportive. So I think, with all this surrounding and the support, plus the feeling that, I'm going to go back. So I took a break. I was in rehab for 1 year. So I did not do the residency the same year. I started next year. I mean, they kept the position for me. That's University of Texas in Houston. So I completed my residency, and which was a challenge in itself, sitting in the chair, taking calls until 2 o'clock in the morning. But I think, I did
Wow.
it.
I mean, I'm getting goosebumps just listening to you. So I wanted to
It was,
interrupt you right there and tell you that, my God, how amazingly, what a courageous woman you are.
yes. And I
Amazing.
think, like I said, it's not just me being courageous. It also depends on the environment you're in, how supportive they are. I
Yeah.
mean, my husband was ready to be there, like to get me ready if I'm getting a telephone call, a pager from the hospital. I have to see a patient. he will not hesitate a single minute, and he will just be right there and do it for me and with me.
Wow.
So that's really, I mean, he gave up his own career. What else he can do? He was doing masters in neurosurgery, but he gave up and he came, and he started because there's nobody. My parents were gone to Saudi Arabia for some time, and my kids were little, so somebody has to be there to be with them. So I think it's a combination of things, but of course it does take a lot of me as a person, to how I look at things, because I realized, my depression is not going to help anybody.
Yeah.
People will come, they listen to me, and they feel sorry for me, and then they leave, right? But it's me facing my family. My kids are growing up. They still have to face the world. My husband, if I get depressed, so I know I still remember they used to pull my parents and my husband to parties and stuff, and I said, no, 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 I think I'm okay. I don't want to go because I knew people would be questioning me, what happened to me, and then there's a joke. If you have time, I can tell you that when we used to go to parties, and if I'm sitting at a table where I don't know these ladies, so they will ask and they will start asking me questions, and oh, so what happened to you? You're in a car accident. Oh, sorry about that. Are you married? Yes, I am. That was like when I wasn't 31 years old. So maybe I did not look that I was married. Plus, I lost so much weight. So, do you have children? Yes. How many? Two. Daughters or son? I have two daughters. Oh, so you don't have a son? I mean, that's a cultural thing at that. Some of the ladies would ask me this question. So one of my husband's friends said, he was quite funny. He said, so next time when they ask you the first question, are you married? You should tell them, no, you're not married. Are you looking for one? And you need help to find you one. So then, I mean, it's just to put a humorous
I
perspective of how things were. So
yeah.
I faced all this. I mean, there were people, and so then I realized that it's sometimes if I'm in a profession or something I'm trying to do for other people, they don't see that I'm in the wheelchair. They don't look at my wheelchair. They don't even. That's not my identity. That I'm handicapped or I'm physically limited. That's not the thing. The thing is what I have to offer to the society, to my people, to make them feel better.
Your identity is your courage.
I mean, it's like, it's a long journey, but
Yeah.
I'm glad that, I did it, and I'm here
Your
talking to you all
courage, your
today.
resilience, your, just sitting there, smiling, giving hope,
Yes,
spreading hope.
yes,
I
there's
mean,
always
it
hope.
is just awesome. I mean, when you responded to my email, and you sent me that email, and I read your email, and I was like, I just I feel all my guests who come, everyone has a story to share, and they come and they enrich my life. Um, but some guests, they leave a lasting
Yeah,
impression, and they have come into your life to literally to enrich your life and to leave you a better person. And I just felt that, what, you are going to be one of those people, so
thank
filled
you.
with hope and such, and hope, hope, and your profession of psychiatry, that's
Yeah,
what people need, right? You literally said in your email that a lot of people, they don't even, all they are looking for is for someone to be there, to just listen to you,
that's true.
to just make you feel that you're cared for, to make you feel that you're important, to make you feel that you're not wasting their time, right?
Yeah. Yeah, I mean that's really important. It's just, and plus it's the total support system. It's not just your psychiatrist. It's just how you gonna make use of things around you, and how to, and somebody has to explain and educate them and their family members. And I think this is not it's not as challenging. It's not as tough. I mean, you can come out of it if you are suffering from depression or anxiety. There's always hope, and things will change. If the good time doesn't stay forever, bad time doesn't stay forever either. So it's just that hope, which makes us, maybe keep moving forward.
So, Iram, moving forward to get into a little bit more tactical aspects of, depression, anxiety. What's the difference between some of these different aspects of mental illness? Things that I personally think, I mean, every individual that goes through, just like we go through physical trauma at different phases of our life, we go through emotional
Mhm.
trauma. I don't think it's like an isolated group of people. I
Mhm.
think I've gone through my mental challenges where life tests you. And yes, multiple times you fall apart, you break down, you feel like, your world has fallen apart. And then I guess that's where it's about, right? You
Then
start
you get up,
putting
yeah,
yourself together
and
and
begin
you're
the
like,
life again. Yeah, yeah. I mean, we all have, all have certain strengths and instinct and things which we could work out and we can handle the normal stress in life. But when we can handle the stress, that's when we either become anxious or
yeah,
depressed. So some anxiety is okay because the anxiety helps us, accomplish our things we want to do, or be successful because we are anxious to finish a job or a work or an assigned project, what we're working for. If you're anxious, we could do a good job, right? If you are relaxed and we don't care about it, then it won't happen. So to some extent, it's okay. But when you're feeling on the edge all the time and your anxiety is in excess of what the trigger is, that's when we need help with. You're just worrying about things which are not, probably they're not real fears, but it's just bothering you that something might happen to you or to your loved ones, and you start having panic attacks. And there are some physical manifestations of anxiety, like your heart is pounding, like, and chest pain, like you're having a heart attack. You start sweating, trembling, and some GI side effects. Some people have nausea or they have diarrhea because they're suffering from anxiety. So it's just a matter of being aware of what's normal, what's not, and and if you need help with that. We just cannot handle every stressful situation on our own. But like you said, you had things, you suffered and you just dealt with it and you got up. We can do it, but sometimes, we just can't. So that's where you need somebody to come and help you.
so I feel that anxiety itself, it's a crippling disease, or
It is.
I mean, the feeling of anxiety where you're feeling like you have lost control,
Yeah,
right?
yeah, yeah. And it is a big, like, let's say, like COVID nowadays, right? So people are apprehensive
Yeah.
because what if you're going to catch COVID? And what happens to us if we get COVID? Are we going to die from it? Or are we going to live like dealing with the complications? Or because I know there are some certain people, this illness is not going away. I mean, they became ill back in March and they're still suffering. They experience something like a brain fog, where they can't think clearly, extreme exhaustion, things like that. So these are all real worries, attached to the COVID, the pandemic, and people suffered from, losing their jobs, loneliness, and just uncertainty. I mean, the whole 2020 was like that. So I mean, the anxiety and depression. I mean, I get so many calls that they don't know what to do in this pandemic. But if you ask them, I mean, they're okay. They're sitting home. Sometimes some of them are working online. So to some extent, they can do it. But they say that's the interaction we are missing. We don't get to see people. It's just us with our computer at home. So this is what it's not,
Isolation.
yeah. So that's what, and I've seen, I know some of my family friends and their friends. I mean, I know that, their kids were in the boarding, in the dorm, and some of them committed suicide, at least two of them I know, young boys. And they were very bright students. And I think that's the only thing we could figure out, that they were so lonely and they just excuse me, did not know how to handle or deal with it. So, like I said, it's just the way we handle things. So, anxiety is the most disabling. and is the most common. I believe it's like 18% of the population suffering from anxiety, and then depression.
And this is just what's probably the numbers are, what's come forward. I mean, there are so many people who don't even get treated for it, right?
Yeah, because they don't realize, and people who are actually there to help them out are not really totally, understanding if something is mentally not right. Because physical illness, like you said, it's obvious.
Yeah.
If somebody gets hurt, if they have an injury, or if they have a fever, okay, we accept that. But mental illness, like people say, oh, it's all in your head, it's your thinking, so do this. And it's true that talking to people, sometimes people sticking to their religious beliefs, and and having some support, like going to churches or mosques, or the temple, that's actually helpful. And studies have shown that religion plays a big role in healing. So it has a healing power. And some other things like exercise and diet changes, but still, sometimes that doesn't just is not enough.
So,
That,
what is the solution? What should people do? People are suffering from anxiety. They do have COVID, especially like I got a message from a dear, friend. She's someone who is part of my women empowerment group, Women of Noor, and she always messages me, and she was like, her husband got COVID, and she is experiencing such extreme anxiety.
mhm,
Her children want her to see a counselor, but she said that she, it's because of that stigma. She's like, I don't know who to ask for advice. I mean, should I even seek a counselor? And I was like, yes, you should seek a counselor. I should seek a counselor. Everyone it's just someone who's professional. It's like having a business mentor. It's like having a personal trainer for physical fitness. The same
mhm,
way, I think a therapist is just someone who's there, who is going to sit there, who's going to listen to you, going to give you, some guidance, some suggestions. I mean, I don't see there's anything wrong with it at all.
mhm. Yeah, I mean, I'm glad that she called you. That's the whole thing, it's how, if you have access to to some resources, or somebody who could guide us, what something is wrong, and you should get help. So I mean, being in this country and other advanced countries, we have this advantage where we have more education, more awareness. But I think even back home, I see people are getting more educated. They're more aware of the mental suffering, and that it needs a professional help. So I guess it does make a difference, when you educate people, like, let's say, for your show, you're trying to bring awareness, in the community, and to look at things, from inside out. What can be wrong? How can they get help? And how it can be fixed? It's just a journey, we all have to go through, and we just have to figure out. And at some point in time, we get to the solution. But I don't want you to wait too long, because when it's too late, then it's going to be seriously affecting your relationship. I've seen many people getting divorces, or breakups, because they have no idea simply how to handle certain situations in their lifetime.
So, Erum, what is the solution? What should these people do?
Well, first of all, like I said, you have to acknowledge that something is not right. You have to accept. Acceptance is the first part. If you don't accept that, no, no, we are okay, I will be fine, then nobody can help you. You have to help yourself, right? So you have to accept, okay, I think I'm not doing well and I need help. Okay, and then there's all sort of resources and help available. You just have to go and look for it. And especially nowadays, it has become so easy. There are so many telepsychiatry places where you can seek people for counseling, where you don't even have to go anywhere. If you don't feel like getting out of your bed, or getting dressed up to go see somebody, you can do it from your bed, from your room, from your kitchen even.
Yeah.
but at least just come forward and seek help. Even if you're not understanding, if you cannot pinpoint or label it as depression or anxiety, but you know your symptoms, right? If you're not sleeping, if you're having thoughts of hurting yourself, you're feeling suicidal, you're feeling worthless, helpless, hopeless, that means something is not right. So just pick up your phone, talk to somebody, and see what kind of help you can get. So sometimes, listening from other people or getting an idea or feedback from somebody who is not close to you actually gives you a better perspective of what's wrong with you.
What kind of tools are available? Does Are there tools which are out there that can be utilized, that uh, places that can be called that can help
Mhm.
um, people who are feeling a lot of depression or anxiety
Yeah.
or feeling suicidal?
Yeah, there are a lot of informations and 1-800 numbers, toll-free numbers, and things you can use. I can actually share on your Facebook and your LinkedIn. I can share some groups and the toll-free numbers where people can call and see, if they don't talk to anybody they know, it's a totally stranger person, they can just get some advice and they can guide them, where to go from there. So I can share that information from you.
And I think that is one of the additional things that you get when you work with a therapist, is the fact that it is a professional who is trained in that field, right? Or you work with a psychiatrist. It's someone who's non-judgmental, and I think
That's the key point.
that's the key.
Would be biased. Like if my daughter needs help from me, I won't be able to, because she's my daughter. I know her and she knows me. So she probably won't consider my advice as like not motherly, but a psychiatric advice. So I mean that's the point. That's the whole thing in asking for help. We have to have somebody who's expert in that field. Okay, because we just don't need the empathy. We need somebody to tell us what to do about a situation we got stuck in, how to move forward, how to come out of the situation we are in. So we need somebody who could actually guide us and teach us some coping skills. Let's say we have a therapy called cognitive behavior therapy. What it does, that it actually, if somebody is in depression because they fail their test again, and so somebody to tell them it's okay if you fail it again. There are times when you pass the test. So start focusing on when you passed, not when you failed, right? So that should give you some courage to actually try again and move forward. So those sort of things, these are some tools which a behavior therapist or a psychologist or a psychiatrist could do, and not an ordinary person could advise. I mean, I'm sure to some extent they could, but we always need an expert person, and who is not related to us, so they can just look at the things from a third party person, and they could, like you said, they're non-judgmental. They're
Yeah.
not judging you because they know you.
And I think that is the key thing about therapists, right?
Yeah.
That or psychologists or psychiatrists, that they don't know you, and they are going to look at you objectively. They're going to assess your circumstances objectively, and they're going to, and
and their
sometimes,
job is, and their job is to get you better. I mean, their
yeah,
job is not to leave you in that suffering. and
yeah,
and and psychiatrists come in the picture when, you know I know the therapy and the behavior modification does a lot, but if it's a chemical imbalance or a deficiency of neurotransmitters, then we need medications. That's where the psychiatrist come in the picture. And by the way, there's always a confusion. People don't know what's the difference between psychiatrist and psychologist.
yes.
Psychiatrists are physicians. They went to medical school. They have all the training other doctors had, except that their field of psychiatry, they were trained in that the most. So, but they're physicians. They can prescribe medications. So sometimes this therapy is not always helpful. It would be, I mean, as a cofactor, like you're taking medications, psychiatrists sometimes cannot see you every week. This is sometimes we need a therapist who would talk with talk with us at least once or twice a week and discuss our issues going on and how to handle certain situations. And the medication starting to taking into effect, and the therapy give you some ideas. You already know what to do, and then you can stop doing that. People have this idea of taking medications meaning, oh, we're going to get addicted to it, we're going to be on for the rest of our lives. That's not true. It's just a temporary phase. You're just taking it when you're suffering. As soon as the suffering is over, we'll be taking you off of those medications. Not right away,
Yeah.
but we will be at some point in time.
And I think that's okay, because sometimes you just need that additional boost temporarily to
Yeah,
help you, to give you that push and to give you that strength, emotional balance that you're looking for, so you can start functioning again. And once you're functioning, you automatically start feeling better about yourself and about your how you view life.
that's
And I
true.
think that gives you the courage to then wean off it.
Yeah, we call it self-esteem. Like when we are depressed, you have a lot of guilt, and things which do not normally bother us will start bothering. Oh, I've done this thing wrong because I'm a failure. I don't think I can do that. Oh, I'm not that strong. I cannot overcome this thing happened to me, and we feel sorry for ourselves. The self-pity. Oh, this thing happened to me. No, you're not the only one. Things happen to people all the time. It's just how we're going to cope with it and try to find ways to come out of it so we can handle it, in a way so we don't disturb, milieu, people around us, our family members who are relying on us or depending on us. We just cannot stay in that state of depression. So there's always hope, and there's always help.
Absolutely. And I think, the starting steps, it takes courage. No matter what happens in life, it takes courage to find hope, to get up, to keep
And
going.
it takes courage to seek help. Not everybody is courageous enough because of the shame. I mean, depending upon their, social setup, what would people would think, that I'm a weak person, I could not even handle this, and how I'm gonna come forward and ask for help because people think that I have something wrong, with my personality. I'm not strong enough. So it's just, yeah, these are the obstacles we have to overcome in order for us, to get the help we need.
So, Iram, we are in, time flies, and we are in the last 10 minutes of our show. And what advice would you like to give to people? What advice would you like to share with people who are suffering from depression and anxiety? And there are other mental illnesses as well, autoimmune. I mean, they're just, I mean, autoimmune is not mental illness, but it
It
happened.
can cause mental illness.
Say that again.
I said it can cause mental illness.
It can cause
All,
mental
all
illness.
the medical illnesses can result in depression.
So, what's your advice to people? What's your advice to people who are suffering from these diseases, or what would you tell them?
Yeah. I think basically I'm going to summarize what you already talked about this in this show. I think it's basically, first of all, that we look at our stressors. What kind of stressors we are facing. Is this something, are we going to handle that, or you think it's going to get out of control? So before things get out of control, I think we should start seeking help, like calling those numbers we have available, and getting some advice from your doctor. The primary care physicians are actually a very good resource. You don't have to see a psychiatrist, and most of our patients with depression and anxiety, they actually get help from their primary care physicians. They can prescribe you medications, because it's not a taboo, it's not a stigma that you're seeing a psychiatrist. So, but do come forward and talk about it, discuss it, not with your family, but with your doctor. I mean, he's there for you, right? And then, I'm sorry, what was the other question you were trying to ask me?
No, just share whatever you would like to share
Yeah,
in these last few minutes we have left.
Yeah, and I think communication is a big factor. Sometimes when somebody is depressed, they'll stop communicating, which is an alarming sign. We have to know how come this person has become so quiet. Something is not right. So,
Stop functioning,
yeah,
especially for
yeah,
children right now in COVID.
are calling sick. They're not going to go to work because they don't feel like it. I have some patients who will say they did not take a shower for about a month, and their kitchen is piled up with dishes, their laundry is not done because they have no motivation, no desire, no interest, and no energy. The energy is gone. So diminished level of interest, no energy, no motivation, and feeling sad, sometimes crying, and even people will just cry looking at TV show, something sensitive, and they'll start crying, which they otherwise would not. So those kind of things, just be careful and be watchful if you are doing something extraordinary, like those things which did not bother you in general, now they're bothering you. That means something is not right. So talk with somebody, talk to your primary care physician, talk to your, maybe even your friend. Maybe your friend has some idea that this is not you, or something is not right, like you suggested your friend to go seek help, the one who had a husband with COVID. So it's just matter of educating people, having more awareness. And like I said, nowadays the world is such that and if you look at, there's some positive aspects too. you know Having this COVID and being isolated in our homes, we are using social media like Zoom, Facebook Messenger, and all those things, right? We are trying to connect with people, and we are getting more educated. Like, I know there are certain groups we are attending, which we would not do because, oh, who's going to go and travel that far to do it? But we just do it online. So there are some positive things happening. So it's just a matter how we look at things. But when somebody is depressed or anxious, they stop looking at the positive things. All they can think is negative and negative and negative. So somebody needs to just come forward and seek help for them on their behalf, or at least explain to them or educate them.
Iram, where can people find you or reach out to you? A website or an email, or I believe you are linked to this program as well, where you guys have started helping people, and you have a helpline that people can call.
Yeah, yeah. Actually, I can give you some of my clinic information. I can post that on this page.
Awesome.
People could call and make an appointment, and we can talk. And then they can always reach me through your program. You have my email address and everything, so they can send me an email.
Absolutely.
Yeah, to help.
Absolutely. Iram, any parting words?
I think just stay optimistic. There's always hope, and be courageous. There's things, with courage you can overcome a lot of things which you would otherwise, you lose your heart or you lose your hope. So always stay positive and hopeful that this thing is going to pass, and I'll be the same person again. I will have the same fun in my life as I always had. So this is and we just have to move on. No matter what happens to us, we just cannot stop because something bad happened to us, or we lost somebody, or we lost this job we were really into love, right? With this kind of any kind of situation which we thought, okay, what are we gonna do if this thing is not happening or is not around us? There's always hope, and sometimes better things come up. So
I think, I feel hope comes from change. And it is important to embrace change in life. And I think, even although COVID has brought about hardships and pain and loss of loved ones for a lot of people, I had someone yesterday who messaged me on Messenger and told me that he's actually lost 12 family members.
so,
And
so sad. Yeah.
so there are people who are in trauma, they've lost their loved ones, but I still feel that no matter what hardships life bring our way, at the end of the day, it is about hope. It is about focusing on, you know, what's waiting round the corner, new things you can embrace. It's a perspective, how you can, change perspective and just look at the glass being half full, and whatever is waiting, be hopeful that it
Yeah,
is going to be wonderful things.
yeah, yeah. I mean, we just gonna take as it comes, and then we'll try our best, to be functional and to be a productive member of the community. So
Absolutely. And on that note, Iram, I am so grateful to you. It's again my honor and my
feel
privilege
humbled.
to have you here. And thank you for being on my show. And I
Thank
am
you so
going to,
much.
you are most welcome.
I
Um,
hope I hope we could have. I mean, we brought some information and some knowledge about mental health, like depression and anxiety, and some awareness to our viewers and listeners. And I hope I'll
Absolutely.
continue to do that. And I really like your show, Heart to Heart. So you keep up the good work. Yeah, you're really
Thank,
giving a good service to your community, which is really a good thing. Okay,
thank you
I'll
so much, Iram.
congratulate you. Okay.
Thank you for being here. Um, so, once again, thank you so much for carving out the time to hear what was shared on today's podcast. If this inspired you to take the next step in your journey, then I want to invite you to join my email list by emailing vip@simadillon.com. And of course, if you know this podcast episode will help someone else, then help me change lives. Just take 30 seconds to simply share the link to the podcast in a text or a post. Just share it on social media, and I'll be so grateful. Until next time, thank you for being here.